Okay, Andrea, you are good to go.
Okay, great. Hi, everyone. My name is Andrea Gonzalez. I'm an associate professor at McMaster University in Hamilton, Ontario, Canada, and a member of the Offord Centre for Child Studies. And I'm today's presenter. As you can see, my title is Measuring Family Violence in the Context of COVID-19, Findings from the Ontario Parent Study. So welcome to Boost's CYAC's webinar series. Before beginning the session, I've been asked to read a few quick housekeeping points, which will make accessing the presentation easier. So for participants that are listening in French, click on the floor button, or the floor, at the bottom left of the screen, and then select French. To see and follow along with the PowerPoint presentation in English, click Presentation at the top left of your screen. To follow along with the presentation in French, because all of the slides have been translated, you can download the French version of the presentation by clicking on the documents on the right. So on the tab on the right, there's a documents, and you can access the French slide there. And you can download the presentation in both English and in French by clicking on that documents tab on the right-hand side. So following the presentation, we're going to leave time for a question and answer period, the last 5 minutes of the webinar. If you'd like to submit your question throughout the presentation, please go to the toolbar on the right and click on the messaging and then participants, and then you can type in your question. You can submit your question at any point throughout the presentation, or I'm happy to take questions at the end as well. If you're watching the webinar as a group, please enter the number of participants in your group by clicking on messaging and then participants. Okay, so I think that was the end of the housekeeping points. So I'm just going to start with the presentation now. So it's hard to believe that it's been a year since the first case of COVID-19 positive person was identified here in Canada. And in the last year, this pandemic has imposed a sudden and unprecedented levels of stress and adversity on the global population. So in the last year, millions of Canadians have experienced some form of prolonged isolation alongside widespread economic hardship that's due to the range of strict public health measures that have been enacted at a global level, federal and provincial and city levels, municipal levels. These measures are being encouraged and in some cases enforced, which is what's happening right now in Ontario, in order to reduce the transmission of the virus through practices of social distancing. The rapidly evolving nature of the COVID-19 pandemic has left governments, public health agencies, community agencies, and academic schools and organizations really quite unprepared to deal with this rapidly developing situation and to fully respond to the increasing needs of caregivers and children to cope with these unparalleled challenges. So when, at least in Ontario, between March 17th and March 22nd, 2020, every province and territory declared a state of emergency. Daycares and schools were closed immediately, many of which did not reopen until July 2020. There were bans of no more than 5 to 15 people, depending on the province, and stores and many services were closed and canceled. During this period of time, in most cases, alcohol and cannabis stores remained open, The exception was cannabis stores in Ontario and liquor stores in Newfoundland, Prince Edward Island, and Nunavut, where prohibition laws were enacted. And this was during the initial lockdown period in early March until June. But we've seen this landscape evolve over time. So there was an easing of restrictions here in Ontario, at least in the summer and in the early fall period, and a gradual sort of increase in restrictions over time, where we're now back to another state of emergency and full lockdown, and all children are in a remote learning situation again across the province. This is a snapshot of cases here in Ontario that was provided by the Public Health Ontario, which is the public health agency here. It was created really in response to the SARS epidemic back in the early 2000s. And what we can see is that during this first wave here from March until June, there was this increase in cases, which corresponded to this lockdown period as well. And then over the summer, there was a decrease in cases. And then starting in mid-September to early October, we've seen this increase. And now, at least here in Ontario, we're up to numbers over the last 3 weeks. We're consistently, we're hitting 3,000 positive new cases per day. And this varies widely by province. I think in the East Coast is dealing with it best. But we know in Quebec that the numbers are certainly high, and in Alberta and Manitoba. Saskatchewan's numbers are lower than the other provinces, but still showed the same pattern of increasing. And it's a similar pattern in British Columbia, although they've managed to bend the curve again. So because of this constantly changing numbers, the situation and the way the governments are responding to this is constantly changing, which creates a very unstable, unsettling situation for caregivers and their children. So what do we know from other contexts? You know, back in early 2020, when the COVID-19 pandemic was declared, there was almost no literature that was available on how this kind of pandemic would affect children and families, and how this full lockdown measure would affect children and families. But we did have some information based on climate disasters that had occurred, or displacement due to war and other sorts of conflict areas. So we very early on looked at the literature to help inform us of the survey that we wanted to develop. And what we found were there were some reviews that could give us some idea of how families and children would be potentially affected by this. So one was a recent meta-analysis. So that's like a data summary of a bunch of different studies. And they really didn't find any evidence of an association between natural disasters and violence against children. But they recognized that there was a lot of heterogeneity between the studies. So studies varied based on the time of the kinds of impact, and the age of the children that were being affected. So it's hard to kind of really look at those kinds of studies over time. A second review examined violence towards children and natural disasters or conflicts, and concluded that violence increases after many emergencies compared to the preconditioned stage, and that polyvictimization, so exposure to multiple types of abuse, seems more common in disasters, and that family members and caregivers of the child are typically the main perpetrators of the violence. So there was mixed sort of information in the literature that as we were trying to move forward with our own study. So what we decided was we would take a socio-ecological approach and really try to measure um, risk factors known for family violence at various levels. So if we look at this diagram here, we were looking at community level factors. So we know that there's a breakdown of social support and networks and a disruption of social services that occur during epidemics and natural disasters. At the household level, we see risk factors such as economic scarcity, so increased unemployment rates and increased poverty and food scarcity, so lots of food insecurity. Loss or separation from family members, and this isn't only the nuclear family members, but extended family members that might often provide the needed support for caregivers. We see changes in routine at the household level. At the caregiver level, there are increased levels of stress, mental health problems, and increased substance use. There's evidence of increased harsh discipline practices and punitive parenting practices, and decreases in overall healthy family functioning. And then at the child level, it's very dependent on the child's own temperament, but we know that there are mental health problem increases under these kinds of stressful conditions as well, and stress responses. So again, very early on in April, there were already reports that were emerging in various media sources that the COVID-19 crisis was increasing the risk of family violence, and in particular, an increased risk of intimate partner violence. And this has been consistent now across the past year, that there are increased calls to domestic violence support lines, and this is worldwide, that domestic abuse cases have increased worldwide, and that these isolation measures really increase the risk for those who are in abusive relationships. And in many cases, governments have responded to these sorts of increases. I know in France and in some places in Canada, they've increased funding supports and offered hotel spaces to partners who feel unsafe, and have increased support to shelters as well. Less is known actually, though, about how this is impacting children. So we know that their calls to the kids helpline are increasing and have been increasing over the course of the last year, but that there's not a corresponding increase in criminal reports. So we don't actually know what's going on and what we're seeing, and is it actual numbers? Like, is it in fact decreasing, or is it just that we're just not seeing it anymore? There was a report in Global News back in April that child abuse reports were down in Alberta, and this has also occurred across the United States as well. Although there's a suspicion that children are more at risk and that family violence is occurring, we don't actually know what's going on. There's a huge gap between what we suspect is happening in the household and the numbers that we're actually seeing in the field. So based on all of this, in March, we launched something that we called the Ontario Parent Survey. We really wanted to get a sense of how families, caregivers, and their children aged 0 to 17 years were coping with that initial lockdown due to the pandemic. And because everybody was stuck at home, there was no way to actually access participants except through a web-based crowdsourcing survey. So we had a marketing consultant who helped us put our messages together, some of which you'll see here. We partnered with a lot of agencies across the province. So we published with public health units, with child and youth mental health agencies, We partnered with some school boards across the province to really help us get word of the survey out. And the survey was a web-based survey, so caregivers could answer it just by clicking on a link, and it was completely anonymous, and they could complete all the questions on the internet. So taking what we were, that kind of model that we were looking at based on other literature reviews of the impact of different kinds of crisis situations, we mapped our measures for the Ontario Parent Survey onto that social ecological model. So for the community level factors, we asked for postal code information, which could be matched with community level data. So we could look at material deprivation index of the various areas. It also allowed us to look at urban versus rural areas in terms of the findings and results. For household level factors, we asked questions about household composition, employment, so whether or not they were employed, full-time, part-time, unemployed, and whether or not there was an impact of COVID-19 on their employment status. And then we asked questions about the caregiver's education level, so what was the highest level of education that they obtained. Then we asked questions about caregiver mental health. We asked questions about parenting, which I'll provide some more details about in a minute, and questions about overall family functioning, partner conflict, which I'll also provide some details about, and alcohol and cannabis use, both within the last 6 months and whether or not there had been a change in alcohol and cannabis use since COVID-19 pandemic was declared. Finally, we asked very general and broad questions about child social emotional functioning and changes that may have occurred in child social emotional functioning since the COVID-19 lockdown had started. I should also mention, I forgot to mention earlier, that our survey ran from it launched on May 5th, 2020, and we ran it until June 19th, 2020. So it was live for about 8 or 9 weeks in total. We didn't capture that very early kind of March, April lockdown period because we launched the survey in May. But we certainly still captured a lot of the lockdown because at least here in Ontario, children never went back to school until September. So we were still capturing that time where families were all together in the household. I just want to briefly highlight the parenting measure that we ended up using. We were trying to get at harsher discipline practices without asking actually about abuse, because this was a web-based survey and it was anonymous. Ethically and morally, we certainly couldn't ask those kinds of questions. So we were considering, when choosing the kind of measure that we were going to use, we wanted to choose something that we could safely ask on a web-based survey and an anonymous survey. And then we did like a systematic review of the types of measures that were out there. And we looked at the psychometric properties, so how reliable and valid the measures were. And then we examined specific questions and subscales and length. And we ended up choosing the parenting scale and specifically the overreactivity subscale. So these are questions that do map on to harsh, angry discipline styles and are consistently linked with an authoritarian parenting style. And this kind of parenting style has been shown in various studies to be linked with an increased risk of child maltreatment. So it asks questions about, raising the voice and yelling. When things build up, I do things that I don't mean to do. When my child misbehaves, I spank or grab my child. I use bad language, and then they could go from this scale that wasn't numeric, but that had kind of bubbles to kind of indicate the degree of severity or the degree with which they identified with that particular statement. In terms of marital conflict, we asked questions about, in the last month, how often did the following occur? And the caregiver was responding both in terms of how they were responding to their partner and how their partner was responding to them. So we asked questions about being angry and annoyed, yelling and criticizing, feeling distant or withdrawn, or flying off the handle and exploding. And the scale ranged from 0, not at all, to 3, a lot. Finally, we wanted to get some sense of what experiences the family was going through due to COVID-19, and we created this measure ourselves based on some of the literature that was out there in relation to natural disasters. And these questions, the participants could just endorse whether or not they had occurred. So it's essentially a yes, no type of question. And they were sort of classified into 5 categories, sorry. So one was whether or not it was related to COVID experiences to do with health. So whether or not they were ill, diagnosed with COVID-19, or someone else was ill. The second category in this box here was related to resources. So whether or not they had a loss of income, were unable to access the necessary food or supplies, prescriptions, medications, services, technology. We had one question here that we analyzed about increased verbal or physical conflict. In hindsight, we probably should have separated this, and we didn't. We asked questions about caregiving stressors related to COVID-19. So increased time caring for children, caring for others, or just being unable to balance things. And then we also wanted to get some sense of, were there any kind of positive outcomes that were related to COVID-19? So we asked questions about new connections with supportive people, eating meals together more as a family, spending more time in nature and being outdoors, or doing more enjoyable activities. This was another kind of COVID questionnaire that we put together in order to assess caregiving stressors. So concerns about managing their own time and schedule and balancing remote learning and their own workload, concerns about their children being upset about the restrictions, and managing remote learning as well. And this was on a scale from not at all to a lot. So now I'm going to present just an overview of some of the initial findings from our study. We were actually very pleasantly surprised by the number of participants we ended up recruiting. We were hoping for a couple of thousand, and we ended up having over 7,000 caregivers and parents who participated, which represented over 14,000 children ages 0 to 17 across Ontario. These are some of the demographics of the sample. So the majority were female, almost 94%. Most were married. We had a small proportion who were single parents, so 6%, and 7% were divorced, separated, or widowed. Almost 89% identified as North American or European ethnicity. 52%, so almost half of the sample, had a university degree, and 65% were employed full-time. So you can tell from the statistics here that this sample is not necessarily representative of the Ontario population. There are more single parents and more ethnic diversity, certainly within Ontario, than is represented in this sample, but I'll speak to some of the limitations of that later. So in terms of some of our key findings, not surprisingly, COVID-19 negatively impacted caregiver mental health. What did surprise us was the number of people who fell into this elevated depressive symptoms category. So 57% of caregivers were reporting elevated depressive symptoms. This is not the same as having major depression. It's not a diagnosis, but what it's suggesting is that people were certainly experiencing elevated symptoms of depression. And this was mostly related to feeling unmotivated, feeling overwhelmed, being just completely stressed and not sleeping well. So things like that were highly endorsed. In addition, 1 out of 3 caregivers reported moderate to high levels of anxiety symptoms during this time period as well. So 17.3% were reporting moderate levels of anxiety symptoms, and 12% were reporting severe levels of anxiety. Another surprising statistic for us was that the alcohol and cannabis use change. So almost 46% of caregivers reported no change in alcohol consumption since the start of the pandemic, but over a third reported an increase of alcohol intake. So of those that had reported a change in alcohol intake, a large proportion of them were actually reporting increases in alcohol intake. And most parents didn't report cannabis use within the last 6 months. So 81% said they had not used cannabis in the last 6 months. But among those that were reporting use in cannabis, over a third reported a change in the amount of cannabis consumption since the start of the pandemic, and 88% reported increased usage. So of those that were using cannabis and had reported a change in the use of cannabis since COVID had started, an overwhelming majority were reporting increases. So what these numbers tell us combined, or what they suggest, is that people were using alcohol and cannabis as a coping strategy. And we know that these are very unhealthy coping strategies, certainly in the long term, and are not useful. We had questions near the end of the survey where we asked parents to tell us about how COVID-19 was impacting them and their children, and it was an open text box. So we have a qualitative collaborator who's working on kind of amalgamating these in a more systematic way. But I had extracted some of the quotes directly to kind of illustrate what a lot of the parents were saying. So there were concerns about children becoming more distant from their activity and friends. And there were concerns about children who had outstanding mental health issues, that they were either re-emerging during this period or becoming more entrenched, so that they were becoming more concerning during this time period. And at least here in Ontario, with that initial lockdown period, services weren't really being provided. Like, a lot of the community services were just not available at that time. Since then, a lot have pivoted, and people are offering really innovative and great programs and services to be helping families. Some of the other concerns were related to screen time. This is an ongoing issue, especially since remote learning is back in place, and kids are really on the screen as a way to socialize with their friends if possible. So in terms of our COVID experiences survey that we put together, here were some of the responses. So almost a third of families had experienced some sort of health issue between between March and June of 2020. So 15% were saying that they were ill, not necessarily COVID-19, but that they had been sick. 12% had someone close to them, but not living with them who was sick. Almost 6% had experienced death of someone close to them, again, not related to COVID-19 necessarily. And others experienced, 8% experienced someone close to them being hospitalized. Almost one half of caregivers reported resource issues, with 34% reporting some loss of income and 48% indicating that a household member had applied for financial help that was offered by the federal or provincial government at that time. So 13% had said that they were unable to access necessary supplies or food. 31% was unable to access usual health care. Only 4% were unable to pay their rent or mortgage, and 5% were unable to pay rent or bills or utilities. And 15% did not have access to the needed technology, so computers or tablets or the internet to support their distance learning, their child's distance learning during the lockdowns. And again, at least here in Ontario, a lot of the school boards have been very proactive in trying to get tablets to families who do not have the necessary equipment in order to support remote learning, and have also offered ways to help connect the families to internet and Wi-Fi services. Not surprisingly, in terms of caregiving experiences, an overwhelming number of parents reported increased time in caregiving for young children and school-aged children and assisting other adolescents. And almost 10% reported additional time having to care for older adults, usually grandparents. So in terms of parents and caregivers' concerns during this time period, almost half reported concerns related to managing their children's remote learning and managing their children's screen time and managing their children's stress and anxiety. 31% were concerned about managing their child's behavior, and half reported concerns about managing routines, organization of schedules, and meals. About 40% of caregivers reported deterioration in their children's behavior or mood. So we had asked a question about just their child's social and emotional and behavioral functioning in the last 6 months. And then we asked a question whether or not, since COVID-19 had started, did they feel that their child was a lot worse off, somewhat worse off, the same, somewhat better, or a lot better. And so 40% of parents were indicating that their children were worse off since COVID-19. That their emotions and behavioral problems were certainly being exhibited in a worse way since COVID-19 had started. And 32%, so 1/3, reported needing assistance with their child's behavior and or mood during the pandemic. In terms of how COVID-19 had affected family functioning, so this was related to the questionnaire about marital conflict. Half reported a high level of conflict with their partner or spouse, with 1/4 reporting having exploded at their partner or spouse in the last month. Parents also reported a high level of conflict in terms of feeling angry or annoyed with their spouse, feeling distant. 34% reported in moderate to high levels of criticizing or yelling at their partner, and almost 10% of parents indicated an increased verbal or physical conflict since the pandemic had started. So caregivers were really struggling with discipline strategies and experienced challenges in their caregiving during this time period. So these results are related to that parenting scale questionnaire that we gave. And about a third of parents reported higher levels of raising their voice or yelling at their child when they misbehaved. 21% indicated getting frustrated or angry enough that their child could see that they were upset. Almost 40% indicated being picky or on their child's back when they were stressed or upset. And 21% indicated getting into long arguments with their child due to misbehavior. When we looked at what factors were sort of associated with these harsher discipline practices, we found that some of the COVID-19 concerns that were related to time management and to routines and the balance of work were predicting higher levels of harsher parenting practices. Concerns about managing their child's behavior and stress was also related to higher levels of harsher parenting. Having a child who was upset or bored and feeling the need that the child needed to be entertained was also related to higher harsher parenting practices. Lower education status was also related to higher harsher parenting. Greater frequency of alcohol consumption and higher levels of partner conflict were related to harsher parenting, and higher levels of depressive symptoms and anxiety symptoms were also associated with higher levels of harsher parenting practices. Finally, we asked, what did families feel that they needed help with during the COVID-19 pandemic? And about a third of parents identified needing assistance with their own stress or mood, and a third reported needing assistance with their child's behavior or stress. And more than half of parents stated that they would be interested in receiving parenting tips and information about children during the COVID-19 pandemic. And this was more related to parenting practices and child development rather than COVID-19 practices themselves. And in open-ended questions, many parents cited the need for respite care, so feeling stressed out, not having access to babysitters or those extended caregivers that typically provide support, or just really needing just a break. Parents also cited greater assistance with distance learning at that time period. This was new to everybody, and caregivers were certainly struggling with it, and that they needed more assistance in terms of structure around lessons and homework. When we asked if parents were interested in receiving parenting tips, what kind of platform or how would they like to receive this information? And about 84% indicated they would like to receive it through some sort of website. 59% indicated that they would be interested in links to videos. 40% were interested in online discussions or platforms, and only 17% kind of indicated any interest in pamphlets. So overall, what do these findings tell us? At least during the initial lockdown period, Ontario families were really struggling. These findings also represent a call for help, with 1/3 of parents indicating that they needed assistance with their own mood and stress, and indicating that they needed help with their children's behavior and mood as well. Some of the limitations of the study and future directions, I can tell you a little bit about where we're going with this. As I mentioned before, this was a crowdsourcing survey. We were really limited in terms of methodology because there was no way to kind of adequately access people during that time, and we were trying to mobilize the survey very, very quickly. But so our reach was actually quite amazing, having had over 7,000 respondents, but really the generalizability of the survey is limited. And again, if you think back to the demographic statistics, there are large kind of portions of the population that we certainly did not reach with this survey. It was a cross-sectional survey, so it only represents one snapshot in time. So from that May to June 8 or 9 week period in 2020. So that initial lockdown period, we don't actually know how families are coping right now. We are planning to do a follow-up survey on a subset of these participants. At the very end of the survey, we asked whether or not people would be interested in being recontacted again, and about 3,600 participants gave us their contact information to reach out to them again. So we are planning another survey. Generally speaking, I think anecdotally, what I'm hearing from a lot of my own colleagues and what I myself am feeling, I have an 11-year-old son, is I think there's a lot of fatigue and burnout. And certainly now being in the second emergency state here in Ontario, and the uncertainty of when kids will actually go back to school. It's supposed to be February 10th, but given our numbers, I don't know if that will actually happen. I don't know how families are actually coping right now, and I think it's important to find out and to see if they need additional services and actually have access to those services as well. So because these findings were quite early in the pandemic, one may ask whether or not they're still relevant and what's going on. And what I've put here are some headlines that came out in the fall based on a survey that was run out of the Centre for Addiction and Mental Health here in Toronto, Ontario. And they surveyed about just over 1,000 people, and found very similar findings to what we found. So one of the main findings was that women, so moms, are at a risk of binge drinking during the pandemic. So that models and overlaps with our alcohol consumption findings. And calls to Canadian domestic violence helplines are still increasing throughout the fall. And that parents and women are struggling with mental health issues during the pandemic. So we know that even though our numbers went down in the summer and that things were more open and that kids were going back to school in the fall, this survey is showing that these issues are still continuing. So in terms of some of the implications and potential ways to reduce the negative effects of COVID-19, there's recommendations that have come from various agencies. So one is to identify, develop, and disseminate evidence-based resources related to disaster mental health triage, and referrals. So I'm going to give an example on the next slide of some of the materials that have been developed by the World Health Organization, in particular to parenting strategies and stuff. A second is to develop preventative public health messaging. So really normalizing that if you're feeling stressed during this time period, that it is normal, and that we have to find ways to limit our stress. So things like limiting the amount of media and social media intake, and being selective about the type of media that we take in. Ways to break isolation, so to try to increase communication with friends and family through video platforms, keeping a regular routine, which I'll talk about a little bit later, and asking for help if people are feeling that the stress is just too invasive. Another is to monitor psychosocial needs. So this is primarily for frontline workers, in either community agencies or within the health field, is to really be clearing COVID-19 related stressors. So exposure to virus sources, whether or not there's been family members that have been infected, how social distancing is affecting people. Insomnia, sleep problems have increased during this time period as well. Measuring depressive and anxious symptomatology, and looking at, increased substance use and the risk of intimate partner violence. Finally, linking resources about stress management and coping. So there's a lot of resources that have been developed and are out there now, including the Centre for Addiction and Mental Health, and the Mental Health Commission of Canada is offering various materials, as is the Public Health Agency of Canada. They have sheets on their website as well. And finally, referring people who have social and mental health assistance or need when they need it. So these are just two of the examples that I had mentioned from the World Health Organization. There was a group of people, experts on parenting in the field, and they partnered with the Centre for Disease Control and Oxford University and all sorts of organizations that help children internationally, and they came up with a series of tip sheets, very simple language, nice colorful kinds of graphics and stuff, to help parents or to give parents tips about how to cope during the COVID-19 pandemic. So the two examples here are keeping calm and managing your stress, so things like taking a break, taking a pause, listening to your kids. Another tip sheet's about keeping it positive and, ways to interact with your child, and whether or not they're different ages, and ways to interact with your teenager, praising your child when they're behaving well, and the type of phrases that parents could potentially use. And these types of tip sheets have been translated into multiple languages and are available on the WHO website in case you're interested. Finally, I just want to briefly kind of touch on, really, when we see in our survey the amount of stress that parents are experiencing, most of our questions were about how caregivers are coping, but stressed out parents equals stressed out children, because parents are really the ones who are creating the context in the environment for the children. So if they're feeling that they're not coping very well, and that their stress is, very high, and that they're using poor coping strategies, it's really going to trickle down and impact on children. And I just very quickly and briefly want to talk about stress in the brain and what this means. So there are two main areas of the brain that are affected by stress. One is the amygdala, which is the brain's sort of alarm system and emotion center. And we need the amygdala in order to detect scary and dangerous things in the environment. So for example, if we're walking down a dark street and someone jumps out, we need the amygdala to immediately come online so that we react and we run away. This process is pre-programmed, it's automatic, and it's immediate. However, the amygdala is not supposed to be the one who's in control all of the time. What we have is the prefrontal cortex, so it's at the very front of our brain, and it really should be the one who is calling the shots. So it's what regulates stress by making things less scary for us. And what happens is when our stress levels are out of control, really the prefrontal cortex is no longer the one who's in control, and the amygdala takes over. So we're over emotional, we're feeling that stress all the time, and our ability for rational thought and processing really is being hijacked by the stress levels and amygdala as well. And from a parental perspective, what happens in these cases is we see these increases in harsher parenting practices, less emotion regulation, less ability to control ourselves, and really an increased risk overall in the family environment. What happens from a child's perspective is that if the prefrontal cortex is not in control, it impacts their ability to learn. So how it, and their ability to process information, so it makes remote learning even more challenging. And really, if that amygdala is taking control, we see a lot of those acting out behaviors in kids as well. So when you're thinking about, seeing kids and you're seeing all these behavioral manifestations of the stress, there is this biological kind of underlying level that's really kind of controlling the situation. So I gave a stress talk to some parents and children before the pandemic hit. This was last January, and I was providing them with some healthy stress management strategies, which I think work under all conditions, and I think are particularly important in really chronic levels of stress conditions like the one that we're currently in. And one of the key ones is really getting organized and having a routine. This was something that came out in the survey where parents felt, more than half of parents felt like they didn't have a routine. So helping parents develop routines is really critical and key, because having that routine is what's going to organize them and it's going to organize their children and the family. Ways to de-stress are reading a book for pleasure, reading a book with their child, meditating. I've tried this myself. It's extremely hard. It's easy to say, to do as a stress reduction kind of strategy, but it's in principle, and in practice, it's hard to do. Eating healthy and getting enough sleep. We know that people's sleep patterns are being affected by the pandemic, and that really both caregivers and children just can't cope as well if they're not getting enough sleep. For children, writing in a journal might be helpful. Getting outside if possible. We're certainly in the winter months here and it's becoming more challenging to get outside, but any kind of form of exercise that they could be doing, and then continuing to connect with supportive adults and caregivers is key. So finally, I'd like to thank the rest of the team. This project was funded by the Public Health Agency of Canada as part of the Gender-Based Violence Initiative and the Promoting Healthy Families project. It's helped us certainly as our research team get the message out of how Ontario families were being affected, and people have been extremely responsive to that, and our messaging has gone out across the province, and people certainly have responded to that in a positive way. The research team comes mostly from McMaster University, but also from the University of Manitoba, so Tracy Afifi and Marnie Brunel, and to Lil Tonmir at FAC for advising and helping conceptualize the measures as well. Thank you. I'll take some questions now, and I'm putting my email up here if you'd like to contact me about any of the information in the slide show, or if you have any questions as you may think of them, if beyond the presentation time. So I'll go to the question period. Sorry. Just scrolling down. So, okay, the first question I see is about a copy of the PowerPoint presentation. It's my understanding from the notes that I read, the housekeeping notes, that you should be able to download the Power presentation in both English and French under the Documents tab on the screen. Sorry, I'm just trying to see. Okay. Sorry, I'm not very good at following this message stream here. Okay. Okay. I can share a link where the WH documents can be found. What I'll do is I'll share it with Pearl Reimer, who organized the webinar today, and then perhaps she could send it to the listserv. So I'll send that. In terms of it not being available in French, I'm not sure if you're talking about the WHO documents, but they should be available in French. So someone asked a question about how can we deal with a family who has had a family loss during the pandemic. And I think that this has been one of the many, many additional stressors of the pandemic, because I don't know what it's been like across the whole country, but certainly here, a lot of people could not go to hospitals, and the amount of people who could go attend a funeral has been limited. Like, I think here it was only 10. And I think that there's a lot of literature out there about natural grieving processes, and I can certainly, again, provide a link to Pearl about some of that and helping the family cope with those kind of circumstances as well. So, okay. Someone was asking about, do I have any ideas of how this study can be done in a way that captures a more accurate representation of the Ontario demographics? So I think there's a few things that are going on since we've launched this study. One is we have partnered with the Métis Federation of Canada, because they're interested in putting together a similar survey as well. And so we are partnering with different agencies actually to help get the survey out there and to have a better understanding of what's happening with families across the spectrum. So we're partnering with a family or a community agency in the east end of Toronto as well to get the survey out, which certainly serves a more ethnically diverse population of people and families. We are also looking for additional partners because we really don't know what a certain segment of, like the most vulnerable families, for example, we don't know what's going on with them. Statistics Canada is also running 4 waves of a survey where they've included questions that are similar to the Ontario Parent Survey. So for example, they've used the overreactivity scale from the parenting survey in this questionnaire that they've had out in the field. So we'll have even a broader Canadian perspective as well from that point of view. Okay, someone said that they'd like to respond to an earlier comment regarding the decrease in reporting of abuse. So I'm happy to hear. Oh, why is it a surprise? I think that, so, okay, if that's the question, is why are the decreases a surprise? I think it's because the numbers have gone down quite considerably, at least from some of the statistics that I've been seeing. And I think, in part, again, during the lockdown period, is because some of the people who generally are reporting child maltreatment, so teachers and daycare workers and other people who work in the kinds of community organizations that see children, just weren't seeing kids at that time because everyone was in lockdown mode. So I think that the reports went down, and this is, I don't know that we have the best numbers, or that we even have numbers, I should say, from a Canadian context, but from the UK, there's been a report released where the numbers have decreased, and we've heard from other kind of collaborators and partners in other countries, like in Italy and South Africa, that they've seen decreases as well during the pandemic. So I think that was it. I know we're getting close to the time, so I'm just going to put my email back in the chat here in case anyone has any questions. And I know I flashed my email up quite quickly, but please feel free to contact me at any time. And I'm happy to answer questions about this or anything else. And we're at 2 o'clock, so I'll just say thank you very much for attending the webinar and for the invitation to present and let you know about some of our preliminary findings. So thank you.